Are you pregnant and having hyperpigmentation? That is a darker face, darker chest, or it could be a darker underarms, darker back, your legs, and all of that. And this is making you have low self-esteem. You're no longer confident in your own skin. Trust me, I was once in that shoes and I totally know how it feels. Look at this, my first picture here. This was me during my first pregnancy. And this is also me after my first pregnancy. That was within 3 to 6 months after my first pregnancy. And this last picture here is also me during my second pregnancy. Would you like to know what I did differently in my skincare routine to achieve all of this? Then stay to the end of this video. Hello, welcome back to my channel. My name is Patience Ehidiamen, and as you all know, we talk about everything faith, nursing, beauty, as well as lifestyle. And today, as usual, I'll be talking about skincare in pregnancy. And the main topic I would like to emphasize on today, which poses a lot of challenges more to pregnant women, is hyperpigmentation. I know a lot of you guys have been waiting to hear about this topic. I'm here to try as much as possible to talk about this in a way that we understand and benefit or gain something from this video. So firstly, I'd like to talk about what hyperpigmentation is. Hyperpigmentation is one of skincare challenges or problems that pregnant women face, whereby some parts of the body, you see them, they just suddenly become darker than the other parts of your body. It could be your neck, it could be your back, it could be your underarm. Personally, I experienced hyperpigmentation during pregnancy, and as you can see, even in this video, you can see my neck is darker than my face. I also experienced darker underarms. Even my lips become darker. This is something I also experienced, and I've been able to curate some skincare products that can help minimize the appearance of this hyperpigmentation during this period of pregnancy, so we can still glow while you are pregnant. So if you think this is something you want to know and you want to learn from, stay tuned while we'll continue with this video. I would like to divide this skincare routine into two different phases, one for face and one for the body. We'll do a face skincare routine, both the AM and PM, while we'll do a body skincare routine, both for AM and also PM. Trust me, these recommendations I'm giving is based on what I have used personally, and it has worked for me as well. So I'm not a dermatologist, neither am I an esthetician. I'm talking based on experience and based on what I have also read. So without further ado, let's dive into this. Okay, for those that are experiencing face hyperpigmentation on their face, radiating to or getting to the neck, just like me, some even experience dark under eye and all of that. So we're going to have a curated AM routine as well as your PM routine. Your AM routine is your morning routine. So firstly, we're going to use a very hydrating cleanser. Oh, I didn't come with that here. A very hydrating cleanser, and I would definitely recommend the one from Anwa because it has hyaluronic acid, it has pentanol, it will strip your skin of its natural oils, it will really make your skin supple, and it's really, really nice. That is what I use. I use the Anwa. I've also used the one from Cosrx, if I'm pronouncing that right. They are both really good. They are good hydrating cleansers. You can use this in the morning. When you're done with cleansing your face with these cleansers, you go in with your toner. And for this toner, we're going to use a brightening toner. Remember, we are trying to tackle hyperpigmentation, so we need products that contains brightening ingredients or tyrosinase inhibitors, which can help combat these challenges we have. So the toner I would recommend I can use in the mornings is the Annual moisturizing toner. It has niacinamide in it. It has licorice extract in it. This will help brighten your face up. It's really, really good, and it's also very, very moisturizing. It's milky in nature. I'll put it up here so you can see it. You go in with your toner. Then after your toner, personally, I top up again with hyaluronic acid because my skin type is dry, so I tend to top up or kind of top up my hydrating routine. So after the annual hydrating toner or moisturizing toner, as you may call it, then you can use this one. If you can see it, you can use this. It contains hyaluronic, 5 different types of hyaluronic acid. Is very, very hydrating. You can see the consistency. It's very, very, very hydrating. You can use this after using the toner. Then after this, you go in with vitamin C. Personally, in fact, I rave about timeless vitamin C and the natural vitamin C on this channel because this is what I have used and what has worked for me. There are several vitamin C's in the market right now, so it depends on what works for you, depending on your skin type as well. So you can either use the one from Timeless or the one from Naturium. So you top up with your vitamin C. This will help fight free radicals. It will help reduce that hyperpigmentation as well. This is really, really good. Then after the vitamin C, personally, I do not use moisturizers in the mornings because reason being that I have used quite a good amount of hydrating toners, and my sunscreen also is very, very hydrating. So after my vitamin C, I go in with my sunscreen, and I use this one from Uncover. I think I've talked about this in this channel, but if you want a detailed review on this Uncover sunscreen, I can do just that. So this I go in with this sunscreen. It's aloe invisible sunscreen, hydrating, has no white cast, it doesn't sting. In fact, this sunscreen feels like a moisturizer. It's so thick. You can see the consistency is so thick. So I go in with this in the morning. So that's my AM routine for hyperpigmentation. Now for the PM routine, a lot of things has to be switched up. First thing first, we'll have to double cleanse. I use the annual pore cleansing oil. I'm going to put it up right here. I use the annual pore cleansing oil. It's really, really nice. It's calm. It doesn't dry my skin out. If I get the job done, it gets the job done. So I use the annual cleansing oil first because you've had sunscreen on. For some of us that use makeup, you've had makeup on all day. You need an oil cleanser that will first of all remove those there. For me, double cleansing is like sweeping your house first before mopping. You get the gist, right? So that is why it is necessary for you to double cleanse. So after using the cleansing oil, you can use a cleansing balm depending on what works for you or what you prefer. After using that, then you now go in with your water-based cleanser or whichever cleanser it is that you are using, but this time around a brightening cleanser. Personally, I use Kojisan soap. Yes, there's a lot of raves about Kojisan soap, but I use that, and the method I use mine is quite different. I don't apply it directly on my face. I I cut it into different shapes because when it comes in contact with oil and water, I notice it tends to melt easily. So I cut it into different sizes and take one piece at a go, at a one piece at a time. So I just take that particular piece, just massage it a little with, rub it on my palm. Then the ladder that comes out of it is what I now use on my face and on my neck. Do not forget your neck, and on your neck as well. So when I do this, it on for like a minute, then I wash it off. Yes, so I wash this off. Remember, kojic acid has this drying effect. It has this drying effect. So you want to top up with hydrating toners. That is why your annual toner is there. This your hyaluronic acid essence is there. I also top up with this Cosrx peptide skin booster. This also has hyaluronic acid, amino acid. It's very hydrating as well. I top up with these three products after using my Kojisan soap. So after that, then you go in with your actives, which is I use this Anua. This is almost out. I use this one from Anua niacinamide and TSA 4% serum. This one has a 10% niacinamide and 4% tranexamic acid. It is really, really good. I've seen reviews on it. And me personally, I've used several bottles. In fact, I think I have to start keeping my bottles now. I've used several bottles of this. It is amazing. It does work, but you have to be consistent to see results. Not after one use, you're saying, or after 2 weeks, you're saying, this product doesn't work. You have to be patient with it. So you can go in with this, your PM routine on your face. You go in with this after your hydrating serum and essence. Then after this, you go in with azelaic acid. I personally prefer the one from the ordinary. It's kind of creamy. It's an emotion. I put it up here. I top up that because trust me, we are blacks. Our melanin is on the high side, and coupled with the pregnancy and every other thing, it increases this melanin production, and you'll be deceiving yourself if you're trying to tackle hyperpigmentation with just one single ingredient. It won't work. Let me just tell you the truth, it will not work. So my dear, you have to tackle it with several tyrosinase inhibitors to combat and at least keep it at bay. Even if it doesn't go away totally, but at least to some extent it will still be minimal. So that is why I use both the annual serum and the azelaic acid from the ordinary. So after that, I top up with a good moisturizer, and I use that from Anua. Please always make sure your moisturizer has lots of ceramides, lots of pentanol. This will help prevent your skin from prevent you from experiencing skin barrier because of all these actives you are using in your routine, and you can then go to bed. Yes. So for the AM and PM routine for your face, this is what I use personally, and it has been working for me so far. And another thing I want to let you know is while you are applying this product on your face, please do not forget your neck. Extend your product to your neck and to your chest area as well. As you can see, my chest right now is still dark, but trust me, it's not as dark as my previous pregnancy. It was way worse than this, but this is a sacrifice that we have to pay as mothers. So this is my neck. It's dark, but it's not as dark as it was during my first pregnancy. So please extend your product to your neck and also to your chest. And another tip I would like to let you know is do not forget your sunscreen. If you're using any of these skincare ingredients, tranexamic acid, kojic acid, azelaic acid, licorice acid, niacinamide, vitamin C, and all of that, and you're not using your sunscreen, trust me, you're wasting your time. Yes, because all of these ingredients are working to reduce the production of melanin, and you're not protecting your skin from UV rays. It won't work. Please, you have to be consistent with your skin, with your sunscreen, and you reapply every 2 hours. This can be challenging, I know, but if you want to see results, you have to be consistent. It takes discipline. Okay. So that's for our AM and our PM routine for the face. Now, to exfoliate, because you can't use this without exfoliating those dead skin cells out. Personally, I exfoliate twice a week. My previous pregnancy, I used lactic acid, but and this is what I've been using for over 3 to 4 years now. I've used lactic acid from the ordinary, but I noticed it doesn't really work so much for me during my pregnancy, so I had to increase my exfoliant to the ordinary glycolic acid. Yes, this is what I currently use, and I use this 2 times a week. And when you're using this, please, you have to moisturize, and as well as add lots of hydrating toners and essences to this. For some people, it's quite harsh for them. If it's too harsh for you, please, for dry skin, you can use lactic acid, and for oily skin, you can use salicylic acid. You must not use glycolic acid. I'm just saying this based on what works for me. That is why I'm using glycolic acid, and it has been really, really good for me. What I just do is after washing my face, the days I exfoliate, I use a hydrating cleanser, which is that from Anua. So after cleansing my face, I let it air dry, and after that, I just apply like one or two pump like this on my hand. Then I massage all over my face. I leave it to dry for some time. While I'm not applying all of this, I've already done my skincare routine and there's a sunscreen on my face, so I can't be applying all of this right now. So I tend to apply this on my face while it's dry. Then I give it some time. After that, I go in with this COSRS peptide. After this, I go in with the hyaluronic serum. Then I let it sit for a while. Then I go in with my moisturizer. So it doesn't really, it's not really harsh for me, and it's working for me so well. I've been using this for over for months now. I think over 5 months or so, and it's been really, really amazing. So for our face, these are my curated skincare routine for pregnant mamas who are experiencing hyperpigmentation. So please, if you've been here with me, if you've been vibing with me with this hyperpigmentation routine, please, and it's been helpful so far, please subscribe to my channel. You will see a bell icon by your left. Please click that bell icon so you'll be notified whenever I post new videos on my channel. Now, back to our gist. Now, I'll be talking about body skincare routine. And for the body skincare routine, we have several skin type as well. Personally, for me, for my body, my legs are dry. I have dry skin on my legs. So these are what works for me. So if you also have my kind of skin type, you can try this as well. Or you put it in a way that it will suit you better. Now, I'll start with the AM routine. For the AM routine, you also want to use a hydrating cleanser, but this time around, a brightening body wash. And strongly recommend this one from Ole Vitamin C body wash. This body wash is amazing. It is nice. When I say it is nice, it is nice. It has vitamin C in it, which will help fight free radicals and also help you reduce hyperpigmentation on your body. So you use this in the morning, then you go in with your body lotion depending on your skin type as well. For me, I use the Nature Well Vitamin C body lotion. I'll put it up here. I use the Nature Well Vitamin C body lotion. That body lotion is kind of a cream. It's not so moisturizing for me. So what I do is I just go ahead and add this Vaseline body gel oil. If you have a dry skin, this oil is your go-to. This one, Chef Kiss, is your go-to. So I just top it up with this, and my skin is well moisturized. And to finally seal up the deal, I go in with my sunscreen. And that is my AM routine for my body. Yes, that's my AM routine for my body. So for the PM routine, you start with your exfoliating body wash. Now it depends on you. Personally, for me, I sometimes I use the body scrubs, but it's stressful. It's stressful for me. Start scrubbing and scrubbing and scrubbing. So for me, I prefer body wash, chemical exfoliant that comes as body wash. So we have different types. There's one from Medic, which has the glycolic and lactic acid. It is super, super nice. It is super nice. That is what I use. It is amazing. There's one from Naturium. That one is also glycolic body wash. You can use that as well. So you use that in your PM routine because we need an exfoliant in this routine to help combat this hyperpigmentation and shed off that dead skin cells also. So you go in your PM routine, you go in with your um you go in with your medis 5 glycolic body wash. So after that body wash, You don't let your skin dry off totally with water. At least there should be some water left. There's a reason why they said moisturize immediately after bathing. Do you get? There's a reason why it's said. In your PM routine, you want to use an exfoliating body wash. After that, you go in with an exfoliating body lotion. And personally, I use the one from Amlactin. There's one that has a green cover, which has 10% lactic acid, and the one that has the blue cover, and that is 15% lactic acid. So it depends on the strength your body can take. You can use any of them. But personally, I use the 15% lactic acid Amlactin from 15% lactic acid from Amlactin, and that has been amazing for me. After that, I go in with my body oil, as I told you before, to seal up and moisturize my skin all night. This is the routine I do at night. And one thing is, for the exfoliating of the body, is not some, although the Amlactin cream, they wrote it can be used on a daily basis. Personally, I feel I cannot exfoliate every day because this can lead to extreme dryness and all of that. But if this is something your skin can take, why not? But I would definitely not recommend that. So personally for me, I do that 4 times a week because it is, the face on the skin on the face is quite softer as compared to the skin on the body, especially that your knees, your elbows, your back, and all of that. So I do that 4 times a week, and it has been amazing so far. So one thing I want to tell us, preggy mamas, you saw my picture after delivery, how my skin came back to how it used to be, and the glow, of course, it was unbeatable. Although I can't wait to get back to that. But one thing you should know is, while you're handling or you're treating this hyperpigmentation and still pregnant, or currently or actively pregnant, please know that for some people who are lucky, the hyperpigmentation might go away during that pregnancy and using these products I just mentioned. But for some people, like me, for example, it might not totally go away. It might just, some part might still be there, like my neck. Other part of my body is quite okay to some extent, but my neck, the hyperpigmentation is still there, but not as severe as my previous pregnancy. Why is this? First of all, we have different skin type, and secondly, you are still constantly pregnant. The hormones that are causing this trigger, the hormones, there's a shift in your hormones, and you are still actively pregnant. The growing baby is part of the reason why there's this hormonal shift, why this sudden increase in production of melanocytes, which is leading to the darkening of some parts of your body. So please, you have to take it easy on yourself. When it doesn't go away, just keep up with the routine. Be consistent. Be consistent. It's going to pay off at the end. And trust me, after delivery, you see that this hyperpigmentation will definitely go totally. But for some people, it might not even go in 6 months, in 1 year, but at least it won't be as bad as compared to your previous pregnancy. And as I told you earlier, you have to be consistent with using your sunscreen. You can't be using tyrosinase inhibitors exfoliating your skin, and you're exposing these new skin cells to direct sun rays. You are harming yourself. You are exposing yourself to sun. You are exposing yourself to the sun. You can get sunburnt. Other issues can come up. So please always use your sunscreen while you are using these products. I really, really hope that this video has been helpful, and at least you've been able to gain one or two things you've enjoyed. If at least you were able to learn one thing from this video on how to care for your skin, because being pregnant does not stop you from glowing, does not stop you from being happy. Because I noticed some persons even have low self-esteem due to these skincare conditions that arise with pregnancy. So I totally, and I really, really hope this has been helpful to you, and you're able to incorporate this into your different skincare routines. If you have any question, probably something you need some clarifications, just put it in the comment section, and I'll be there to try as much as possible to explain to you even more. Thank you so much for listening to this video and for being here with me. I'll see you in my next one. Bye.